Hi, this is Mike with Relational Advisors, and today I have Vannessa Ruiz, she and I have been working together for like 20 years now.
Long time.
Welcome. And Kristin Conti, which we haven't been working together for 20 years, but I've known you for a long time. And Kristin is the program director for CareGuides, and happy to have you back on.
Thank you for having me.
Absolutely. So today we wanted to tackle a really, a critical topic for a lot of us, which is, just navigating healthcare. And we were talking about with Vannessa and Kristin together, and we're professionals in the business, been insurance brokers and consultants for 20, 30 years now, and we've just noticed in the last probably 5 years, maybe 10 years for sure, but even in the last 5, that it is increasingly difficult for the average consumer, person that doesn't know insurance, just to navigate the healthcare system. Once you go in, you meet with your doctor, and then the claim gets kind of magically filed with the insurance company, and then next thing you know, you get a letter back saying that something went wrong. And I thought maybe we could start just a little bit with you, Kristin, and talking about as a provider in your history, like all of the time constraints that you guys have, and maybe share like a little day in the life or a day, moment in an encounter when somebody comes into the office. Like, what are all the things that the providers have to go through that I think part of it contributes to, this environment of confusion and difficulty of getting the claims paid?
Yeah, so I think what people don't realize a lot of times is that we have metrics to meet, right? So maybe you have to see 20 patients in a day, and maybe you have 20 minutes allotted to the encounter, but that includes the time the person checks in to the time that you do intake with the technician and then see the provider. The expectation is then that you would put in potentially all the orders and notes and be done within that allotted time, but unfortunately that's not realistic. And if you have other people, if you're booked back to back, let's say that somebody waited 4, maybe 8 weeks to get in and see you. So now they have a list of things that are
Sure.
a priority in their world. And you're trying to, fast track them through the encounter so that you can attempt to address even half of those things. But then you're deferring and telling them that they need to follow up and book an additional appointment. And again, these things just get drawn out and drawn out and drawn out. So now you've created a situation where somebody's like, I feel like, my life or my health is in jeopardy, and you feel like you don't have the time to be heard by the person who should be listening and being able to address those concerns. And again, it's not that they are careless in that particular circumstance, but just they're in a bind, right? There's all these outside pressures, and then imagine too, like you're super busy, right? And you're out in the waiting room. If you're waiting 2 hours to see your provider, now it's derailed your afternoon, right?
Sure.
So if I don't stay on schedule, that has other implications.
Yeah.
And you're kind of caught in this perpetual cycle where, you have all these things that need to be addressed, but not enough time to do it. And then again, imagine, like we always talk about lifestyle interventions, right? And the thing that's easiest to give sometimes, because there's always the psychology behind an encounter. But let's say that you have this expectation you're going to leave with something. If I have to coach you on how to change your diet and lifestyle, that's going to take a lot more than 15 minutes.
Yeah, I'd much rather leave with a prescription that I can take to the pharmacy, right? I mean, it's almost like that's the expectation, I think, these days. It seems like, I'm going to the doctor, I'm going to get a prescription, but that's not always necessarily the right thing. So when you are then with the notes and you're hitting submit, and the system sends off a claim to the insurance company, then on our side, the way that it comes to us is sometimes an employee will reach out to us. And so Vannessa, then maybe share like some of your experiences in the last few years of just having some of the difficulties that we've run into. It feels like today, back when, humans who were trained and involved, they would look at a claim and, kind of make a decision. It seemed like a, much more collegial environment to get somebody to look at a claim, where now so much of it is automated and they just get kicked back, and then you got to kind of fight the system. So like, how does that sort of present itself from your perspective in your day-to-day?
Well, most recent days, it's been pretty much daily. And I guess it just depends on, right, the visit and the claim. More recently, it's been prior authorizations, right? Authorizations for injections, or maybe they're going to get their MRI and they think the authorization's been approved, and that hasn't happened. But from a pure claim standpoint, I think what we see is a lot of times, most recently in the preventive visits, where the labs are getting denied because they're not coded correctly. They're coded as diagnostic instead of preventive, and so people are being billed from that aspect.
So let's pause on that for a second. So, with healthcare reform, preventive care is supposed to be covered at 100%, right? With no copay, no deductible, et cetera. And so what you're saying is people are, participants, employees, patients are going in for what they think is a preventive care visit, which then should be covered at no cost, and yet they're ending up with a bill. Is that
correct?
Yeah. Okay. And so, from what you've seen, what's happening either at the provider level or the insurance company level that's ending up kicking out a bill to them?
They're being billed as diagnostic as opposed to preventive. So, right, those labs are not covered, so they're being denied.
Yep.
And from a member's perspective, right, I just went in for my preventive, should be covered at 100%. Why aren't they paying anything? So that's been more recent. Even as much so as what I've seen more recently and have experienced personally is when you are going for your preventive, right, your scheduled visits at certain ages, they want to do a new patient visit. So
Interesting.
now you're no longer getting that preventive at 100% because you have to see a totally different provider to get that type of screening. And, you have to shop around in essence for providers who are going to honor the full visit being covered at 100% because you're not really relationship building, you're just getting your screening.
Right.
But they're requiring that new patient visit and it's being billed as non-preventive, a new patient office visit.
Right. So your copay or deductible, whatever type of plan you have, is then going to kick in.
Yep.
Interesting.
Yeah, and it might be too that they don't even realize exactly how it's impacting the patient as far as like what their insurance covers or doesn't cover, because sometimes they're totally unaware of that.
Right.
I think sometimes what happens is because of these time constraints, so I can't do all this stuff in 15 minutes, but how do I collect the right information and make sure I can address everything? Oh, I'll make everyone do this initial intake, right? And instead of having 20 minutes for the encounter, I now have 40 minutes. Or same thing with like a procedure, for example, and then you segment all of it and then you can bill for all of it so that you have the allotted time for each issue. But you don't, again, necessarily know how that's going to impact a patient. So like another example would say you come in and your blood pressure is elevated. I'm like, oh, okay, so you might have hypertension. This is going to be our plan. We're going to do a lipid panel where we want to check and see what your risk of cardiovascular disease is. That's going to be diagnostic, right? Because now it's associated with a condition.
Correct.
Versus you just coming in and we're trying to do screening, and then that would be preventative. So if you put like a Z, for example, in front of the annual wellness visit, then that all gets billed as preventative versus having something like a typical 99213, which is basically saying you have moderate level of acuity. It's going to take me about 20 minutes to address your concerns, and I'm going to attach that with a diagnostic code, right, like hypertension. Then, again, you might be having the exact same conversation, but the way it gets billed is different, and then what's covered is different as a result.
Right. And I find it so interesting because I often find myself saying, well, often people want to know, well, is it the doctor's office fault or is it the insurance company's fault, right? And I say, well, in the doctor's office defense, they have so many patients, so little time, and so many insurance companies that they're dealing with. In the insurance company's defense, if they simply let the guard down and paid everything, they'd all be out of business and we wouldn't have a financing system, right? I mean, the reason that these systems are in place is to have kind of checks and balances, but for all of us as consumers and patients, it just feels like a giant headache. It's tough.
It is, even from the provider side, but in some ways it's kind of everyone's responsibility to learn this, right?
Yeah.
Because it's the same thing, like let's say I pick 2 antibiotics. Well, I'm just looking at the standards of care and okay, your culture is positive for this bacteria, it requires this antibiotic. But then I might look online and realize, oh, okay, well, this antibiotic is going to cost my patient $5. This one's going to cost them $500.
Right.
That might change the way I prescribe just by knowing what it's going to cost them. Then the same thing with billing for the visits.
You know, we were having this conversation the other day. There was something really interesting that happened, and you can explain it, but my layman understanding of it is that, you know, if we have a patient that's seeing a doctor for a particular, you know, treatment plan, they've been going to this doctor for years and years, and all of a sudden, and they're accustomed to paying one number, and then next thing you know, it goes up double or triple. So share with me, like, from your perspective, you know, what happened in that scenario that you know is just a giant mystery to the participant. All they know is they were paying, I'm picking a number, they were paying $20 and now they're being billed, you know, $300 or whatever. How do those things happen?
Yeah, so in one particular circumstance, I had a client who was going for the same service, same facility, same provider, and doing that for a prolonged period of time, and then randomly gets a new bill, right? So all of a sudden, they're thinking like you were saying, what's happened here, right? Same insurance plan, so it's not like their coverage
Right,
changed.
didn't seem like anything changed, yeah.
Exactly. We ended up getting some more information and realized that the claim was processed incorrectly. So there's a contracted rate that United Healthcare, for example, would have with a provider or a facility. And then the second component of that, once that was adjusted, is that the person or the department processing the bills for that particular clinic had changed. So instead of it being billed as a provider visit, which United Healthcare had contracted at, let's say, $60, was now billed as a facility visit. And so now that contracted rate for the same service is billed at $280. That's a big difference in cost. So I guess the other thing that people don't think about is how is it billed: diagnostic, preventive, is it a 9921? There's all these different codes, right? It's this whole other language. But the other component of that is you also have the place of service. And the reason that happens is because, let's say you go have surgery in Manhattan. The overhead cost to run that facility is going to be a lot more expensive than it is going to be in a small town in the middle of nowhere. Even your rent is more exponentially more, right? So even getting a Tylenol, one tablet, is going to cost you more because the cost to run that facility is going to be factored into
all that
every
overhead
intervention.
is baked into it, right?
Exactly.
And so when we talk about the place, you know, like I think about it, I remember, you know, if you needed an outpatient surgery, if you went to an independent outpatient surgery center, it was, you know, let's say the facility fee was $1,000. But if you have the same surgeon and the same surgery and they do it in a hospital setting, it's going to be $5,000 just because all that overhead is kind of piled in there. But we as consumers, I mean, we don't generally know that level of detail.
Yes.
So it can be, you know, a lot of surprise at the back end. And I guess, you know, while we're talking about being fair, to be fair, whether it's United Healthcare or Anthem or Cigna, I mean, all the insurance companies have all those different, you know, layers of codes. Yeah, right, exactly. So Vannessa, in terms of some of the other like claim issues that you've seen and you know worked on, what are some of the other themes that kind of emerged for you as you think back through those?
All kinds. As I mentioned before, just, you know, diagnostic versus preventive. More recently, we did have an authorization in place where the provider must have lost it, misplaced it, didn't think they had it, obviously didn't have the time to research for that, billed a member, contracting provider, billed member directly, member paid out of pocket, and I tried to submit that claim to the insurance company, but because they're contracted, I have to go back to the provider to get them to bill after they've gotten the member to sign saying they'd pay out of pocket. So
Wow.
Ouch.
Yeah.
that's something that's currently on my plate right now.
Right, yeah. Well, and one of the others that I know I've run into personally, and we've had clients that have too, is, you know, the insurance companies contract with third-party providers to then go through, they say, okay, well, we've paid all the claims, and now we're going to send that claim data to this third-party provider, who's then going to go through it with a fine-tooth comb and say, oh, well, actually, Kristin, you should have been covered on Medicare or Medicaid or had some other third-party insurance. And, you know, if you're talking about $1 billion of claims and they're going to fix 2% of it, well, that's, you know, it turns out to be a lot of money. And so I've had some invoices that came like over a year later. I'm like,
Sometimes 2 and 3 years later.
hey guys, you know, my ability to file this claim is long gone. Right? You've got to is it usually a year between the date of service and
I think it
when that
also
claim needs to be filed?
depends on the state, because usually the insurance company requires a year. But as far as what they're allowed to bill for, I believe here in California, it's 4 years. So even though your time
Yeah.
for filing the claim is a year,
Right.
that provider can bill you up to 4 years
Wow.
from that claim.
Yeah. Yeah. So lots of mud puddles to get stuck in for sure.
Yes.
And Kristin, in terms of like from the provider's perspective, I think you said it well, which is, we don't always know how that's going to impact, the insurance plan. And maybe as a question to both of you, but what do you think are some of the things that employees and participants can do to sort of, arm themselves a little bit in terms of hopefully avoiding some of these things?
Well, I think one, as healthcare evolves, I think you have to understand the limitations that you're working under, right? So, for example, if you have, you go in and have that initial encounter to establish a relationship, and then you say, okay, I have all these other concerns. How can we set up multiple encounters or subsequent encounters to address each one of these things? And then maybe on the provider side, even just knowing like, okay, if I'm going to order labs today under an initial visit, that's going to be coded a little bit differently than it would be for a preventative encounter. So then I can just start by kind of structuring my time and setting expectations with that person so that they get all of their concerns addressed. But then we can also, not spend 2 hours in clinic or make them come back
Yeah.
20 times or
Right.
start to do something that
Right.
makes them feel like they're constantly being pushed off or deferred.
So if I hear you correctly, is it from the provider's perspective, the type of encounter that you have perhaps dictates the amount of time within that visit? Does that change or no?
It can change. It kind
Okay.
of just depends on how it's set up. Like sometimes you can advocate for having 40 minutes for a procedure, but most encounters are going to be a 20-minute.
Got it. Okay.
If it's something simple, then maybe you would justify having a 10-minute encounter, right?
Right. Got it. Okay.
It's like, I have a runny nose. Oh, okay.
Yeah. Here you go.
Here you go.
And what about from your perspective? What do you think people can do to?
Well, I would definitely say to recognize that they are consumers and they need to be aware that in that setting, they're still a consumer. I think some people think of healthcare differently. So they're going to a contracted provider. They're relying on the fact that because this provider is in network, things work a little bit differently. They're signing forms blindly saying, all right, and what you're in essence saying is that if this claim is denied for any reason, even
You're
if
on the
it's
hook.
no fault of my own, even if it's the fault of the provider in some instances, because it does happen, I will be responsible.
Wow.
So, I did have,
It almost seems like that form shouldn't be allowed if you're an in-network provider.
100%.
Right.
I don't really understand it. And even when I'm personally in those settings, and I had a member who was having a dependent have some procedure in an in-network facility, and they were adamant about having them sign this document. And I said, because this person called me, I said, write in that I will not be responsible
Right.
for the fault of the provider who did not do their due diligence prior to as a contracting provider.
Right.
And there was some back and forth, but ultimately they did accept that. And I think when you are going in network, you do expect some sort of protection, right? I'm
Right.
in an in-network
Exactly.
provider, I'm getting negotiated rates.
That's what we're all trained to ask for and trained to do, right? And then next thing you know, it's not giving you the
Exactly.
protection you need.
Exactly. And this particular person had done their due diligence. They had done it weeks in advance. They had reached out to me. We kind of, did some steps prior to, and then the day of, all of these things came up. So I think, to know that we are consumers, we have a choice, and to make sure we, read through what we're signing.
That's a good point. I think sometimes, too, there's other things that didn't even occur to me until recently, right? And I've been working in healthcare for almost 20 years. You can ask for things like an itemized bill,
Yep.
just to see, like, did all of those things actually happen while I was
Right.
there?
Right.
And you can actually say, I want to dispute this claim. Can you reprocess it and make sure that it went through and everything is correct on here?
Yeah.
I mean, those are all things that I think patients realize that they might not even have access to they don't even know that they have that as an option, right? As a
Right.
responsible consumer.
And also a predetermination of benefits. You may not be able to do it for an office visit, right? You're going for
Sure.
a standard office
Right.
visit, but if
If
you
you're
know
having a
you're having a
surgery or something.
procedure, you can have them, run that claim through prior to the procedure to know, and that provider should be listing out in an itemized format what they're going to do. The insurance company looks at it, looks at their rates, so you can know what's applied to my deductible, what's my out-of-pocket.
I'm thinking about someone in my family right now that is, probably going to need a procedure done, and I don't think I gave that advice, which is really, I'm going to as soon as we're done here. That's really good. So if I'm hearing you, I mean, just a couple things, right? One is for the preventive visits or the well visits, make sure that they kind of stick to what's approved on that menu, and don't bring in a laundry list of issues, right, to that meeting. Or if you do, which is fine, just be prepared, you're going to have your copay or deductible that applies to that. But if you're really just looking at the screening, keep it to the screening, and then that should be covered, no copay, no
Exactly.
deductible. So that's one. Two is make sure that you read what it is they're putting in front of you, because I know when we go, it's like 5 pages, and there's, HIPAA authorizations and all that other kind of stuff, but there's definitely patient responsibility. I know I've signed off on those as well and probably didn't read them as closely as I should. And then the third would be the, predetermination if you're going in for a procedure. And that way, that provider can run it through the insurance company, and they'll, in essence, give you kind of a forecast of how that claim should be paid, so you don't have any surprises there.
Right. And just know that you have a choice. It's convenient. I've been going to this doctor for 10 years, but right, practices grow, people change. Is it worth my time waiting 2 hours to see this provider and signing off that I'm going to be responsible for
Right.
whatever happens in that?
Yeah.
Or, shopping around in your network to see, who's going to give me the most bang for my buck, so to speak.
Right.
Yeah.
Yeah.
It
Yeah.
really kind of just depends, right? Everybody has a different set of priorities. We have a provider who I feel like is very similar to how I was when I was operating in the military, but it might take you forever to get into his clinic. He's always running behind, but whenever you have him, you have his undivided attention, and you don't leave there without having all your questions answered and feeling like he fully met your needs, right?
Yeah.
So, but not everybody has the time and the ability to wait like that. So
Yeah.
maybe you want somebody who's really concise and punctual, but they're going to be a little more cutthroat, right?
Yeah.
A little more direct and to the point. And so, like you said, people just need to know that they have a choice and that they should choose somebody that they feel is right for them and can meet them where they're at.
Yeah. I would say in closing that I do feel like there's a fatigue, from participants. It's like, oh my gosh, I've got to go through this other hurdle. Can't they just, pay the claim or get the approval? And my heart, goes out to them and all of us that are in that situation. And so that fatigue, I think we try to address that and be as, certainly as understanding as we can, but, working really hard in the background to get those either the approval or the claim paid, because it's stressful. You're dealing with your health, you're dealing with a lot of money, and that's tough. All right, so we have learned preventive care visits, pay attention to that. Make sure you don't just sign willy-nilly and read through. Do a predetermination and be a consumer. Shop around, advocate for yourself. And I think, when I think about the advocacy side of it, obviously there's industries that have, grown up, and that's what CareGuides does. But also sometimes if it's really a complex medical issue, maybe bring a family member along, because you only hear a certain amount, and sometimes afterwards it's easier to say, hey, okay, did you hear this? And what did they say the next step was? And really, really important.
Yeah.
Right. And just know your resources, right? For our clients and our members, right? We make ourselves available. We have access to the CareGuides team and just, you know, you can
And start with
utilize that.
human resources, right? You know, start with your HR team, and
Yep.
they'll be able to, you know, bubble it up and direct where it needs to go.
For sure.
Yeah. For a lot
Awesome.
of my family members, what I like to do is pretty much like write out their encounter. This is my past medical history, past surgical history, all of my medications. These are the things I'd like to address. And then that way, when you're rushed, you're not like, you know, getting distracted. You leave
Yes.
there and you're like, I should have said this.
Right.
I wish
totally.
I asked that
Yep.
question.
I've done that.
And
Yep.
so you keep everything nice and concise and organized. So you know, I mean, I know from being a provider what the expectation is. So
Sure.
I can kind of like, okay,
Right.
here's the information they need, and here's what you want, and so
Right.
now everyone's happy.
Right. Well, not everyone has a Kristin, but
But they could have a CareGuides.
They could have a CareGuide.
Yep.
Awesome. Well, Kristin, Vannessa, thank you very much. Really appreciate the time. Good insight. And thank you.
Thank you.
Thank you.